Yeah, my name's Don Spencer. I'm a retired psychiatric social worker. For about 55 years or so, I worked in community mental health as an administrator, fundraiser, organizer, director, all of that kind of thing, and also in clinics and private practice. Several of us late winter became very concerned about what's going on in healthcare, the attack from the federal level, this present administration, which is becoming more and more vicious, that to destroy the systems, the infrastructure. We call this podcast Reclaiming Care. And what several of us mean by that is care at all levels, the professional level, the lay level, the grassroots level, the caring for one another as human beings. As most of us are aware, the attempt is to divide us as Americans, as humans, into opposing camps that will fight and hate and try to do everything we can to destroy each other. We have to find a way, those of us that have worked in the field and those of us who have benefited from the care. So we're looking at behavioral health care now as part of the healthcare system. Now, behavioral health care is a new nomenclature, if you will, from mental health, but now it includes, and thank goodness it is, both substance abuse treatment and mental health. The integration at the local level and at the state and national level is a welcome change. Clinicians, administrators from both sides are beginning to really talk to one another and understand that treatment needs to be coordinated. Now, at the grassroots level, what can professionals do? And do we have to rename or refocus our skills in new ways to help at the grassroots level? So that's just a bit of an intro. This is for welcoming everyone and anyone to join us in this conversation. I have two people with me today who have both worked in the field of substance abuse and have experience. And one is my friend Justin, and the other is my friend Christine. So I have three questions that I have for each of you. The first question is, how do each of you think or see that we can keep caring alive now in our country? That's a tough question.
What I think there is that for caring to be alive and for it to stay alive in the country in today's age, it's really important for there not just to be some generic compassion being displayed to people, but there actually needs to be empathy being displayed. People can show that they actually care for these people, what it means to them to actually, find a solution to their problems, find something that can be fitting, to truly listen to somebody, what their past experience are, what they've lived through. It's about just seeing the person and not just the problem. It requires a willingness to acknowledge the gaps in our systems and to understand that people navigating through them, they need insights. They need to understand things in a better way. And we can keep this alive by being able to listen, learn from people, and show them what we've learned from ourselves. I think that all those things can really help, and a lot of stuff often gets overlooked today.
Yeah, I like that. Christine, could you add to that or put it in your words?
I can add to that, Don, and I will. First of all, Justin, you absolutely took the word directly out of my mouth, empathy, and how you can never have too much of it. It can be integrated into the behavioral health system more fully on every level and can kind of be like not quite the solution, but the balancing point to the sterility that has become what my personal soapbox is, which is the for-profit treatment centers for addiction, substance use disorder, substance abuse. There's many synonyms. But I think in my own experience, having worked for a for-profit organization, a company, essentially, that provided treatment services for persons exclusively holding Medicaid insurance, I was a little more than a little struck by the amount of one person equals X number of dollars. The amount of the attitude, the breadth of the attitude, truly, seeing that these people were not just, or were not patients, they weren't clients, they weren't even human in some cases, they were dollar signs. And that's I mean, that's my soapbox. That's truly what gets me fired up. But I think when it boils down to what we need to incorporate more to talk about the solution rather than the problem is empathy at all levels. Whether it's formalized training for professionals, more conversations about it at the most bottom of the totem pole, grassroots type situations, whether it be in recovery meetings or mental health support groups. How do you display empathy? How do you recognize empathy? What do you do to cultivate empathy amongst your peers? I think these are absolutely essential conversations that we should be having a lot more often than, in my experience, we as people do.
Let me see, to respond to what both of you are saying, Justin, both of you use the word empathy as very, very powerfully as a critical part of the work and being human. And you mentioned listening, Justin, as a part of that experience of empathy. I wonder if each of you could put some flesh on those bones. And you can do it in terms of personally, if you think of an example where someone really listened and you felt that kind of empathic connection, or in your work, how you noticed it made a difference for your client, for yourself. Can you put some, I said meat on those bones?
Well, I would say for me, you know, in one area, the negative side I've felt myself is, in the, general care facilities, I've had doctors or therapists that didn't show any little bit of empathy at all. And I always felt discouraged to even want to continue going. They felt like you were saying, Christine, I was just a money symbol to them. They didn't care about what was good for me. It was either, just take a medicine, let's treat the problem, or let's treat the symptom, not the problem. That was usually their go-to. But then, when I was in the field working, a lot of people that I actually sat there, listened to them, actually cared about what they were going through and what some of the solutions were. I could notice just that spark in their eyes. They felt like somebody was there willing to hold their hand and walk them through the process. And that inspired me too, being able to feel like I'm actually truly doing something that's making a difference in somebody else's life. And that's what it should be. That's what the purpose of the whole program is, that exists today were originally founded upon. And yet in today's world, money is one of the main factors on, why people get up to go to work. I get it. Money is what we all need to survive, but it shouldn't be the purpose of why these programs exist.
And you mentioned the spark in the eyes. Is it almost like for you, Justin, when you know a caregiver is really in touch with you, is it almost like seeing it in a way? You can see it in their eyes.
Yeah, they actually, they're excited to, if they see that you're getting better, that's something that, they got a chip in their voice. They're smiling more, and they're like, "Hey, that's great. Now we
Yeah.
found one problem that actually has a solution now."
Christine, can you think of an example or how it is for you when that empathic power, if you will, or connection, it's so hard to put it into concrete words, but can you think of an example for yourself or your work?
I can, and I'm glad you're asking for examples because I think that's what makes such concepts that are sort of abstract for a
Yeah.
lot of people, and maybe for some of our listeners and viewers, makes them more concrete, tangible. I understand what they say, what they mean when they say empathy. So, in my experience with recovering persons, there's a lot of I'm expressing a person A is expressing a problem. I'm struggling with my child. I'm trying to get clean. I'm struggling with my child and these problems. And person B, maybe a friend, says, "Well, I had a child problem once and this was my child problem. Let me tell you all about my child problem." And I think most people are trying to
Yeah, I had a
essentially
couple
say, "I
daughters.
relate." What's that, Don?
I had a couple daughters like, fix them, fix them.
I think they're trying to say in a long or roundabout way, they may not even understand it, but the friend of the complaining or, problem having person is trying to say, "I relate to you. I've been in your shoes. I hear you. I feel you." But they don't often say any of those things. And it's because communication skills are not often truly taught in places such as treatment centers. And again, I go back to that because that's the majority of my experience. But I have learned professionally with clients, even with my own friends, my own family, it's about consent in the conversation. And what I
Now,
mean by
what was
that
the
is,
word?
I'm coming to you, I have a problem. I have a problem with my child.
Excuse me, Christy, I lost. Did you say consent in the
Yes,
conversation? Okay,
consent embedded within the conversation.
okay.
So, say for example, we go back to this person A who's saying, "I have a problem with my child. I'm trying to get clean. I'm in treatment, and this is a huge problem, and I'm so upset about it." Instead of saying, "I had this problem too," person B can say, "How can I support you?
Yeah,
What are you looking for right now? Do you want feedback? Or do you just want a shoulder to lean on? Because I can zip my lips and give you a shoulder to lean on if that's what you're looking for." So I think getting that consent, being like, "Do you need this? Do you want that?" is really important in conversations to cultivate empathy between two people.
so what
I hope that makes sense.
yeah, Justin,
Yeah, it does.
what I'm getting from both of you right now is with listening empathically, you're saying to another human being, I want to know about your world and your experience and what that's like for you. Not what it's, let me tell you, as you emphasized, Christine, let me tell you about my world. I mean, who gives a rat's? The person's out there to hear about my world. As a therapist, I have at times shared, some personal or learning experience, but it always has to be at the right moment, at the right time, sharing that, or we'll lose one another. Okay. So, could each of you summarize so far where we are in this conversation? What are you two getting from it? I want to add something real quick. When I began to lose my empathy in a therapeutic situation, I just didn't know what to do, and I was kind of lost. I would try harder. I would go into fix it mode. What can I do to fix it? It was automatic. And the harder I tried to fix it, the worse or the more a conversation, therapeutic conversation, will go downhill. Okay. Does that make any sense? You Instead of saying, hey, my friend, I'm kind of lost right now. What's going on? And people go, oh, really? Well, they're not trying to fix me, but they're helping together to recover the conversation, to get it back on track. Okay. So what do you two sense we're doing right now? Where are we?
Well, I think we're going over from both our experience and our views on you know what is struggling with the ability to care for people in today's healthcare world. Christina, from what I understand, one of the things you were saying is a lot of times it's the facilities themselves that want to silence us from even showing any empathy. Is that a lot of times what you've been feeling when you're at your place of work and, trying to help
With
people? You almost
certain
feel like, go ahead, sorry.
My mistake. With certain groups of professionals, I would say yes. I have gotten that feeling, especially from the top down in certain organizations, that, like, "There's no time for empathy here. We gotta churn people in and churn them out."
Get him
And
in
that
and out of the
bothered me
door.
most. But second most was for those that were actually treated, they weren't treated in a compassionate way, and the empathy factor wasn't cultivated with the clinicians.
And I think a lot of times people, when they're training to work in these situations, compassion is never a topic of discussion usually. So you don't even know how to do it a lot of times. People are more talked about just, the key areas of what you're supposed to be focusing on. None of the personal areas are ever covered. You know, emotions are not a factor ever.
So you're both emphasizing this so strongly today: compassion, caring, empathy, dissolving the bridge. I'm the therapist or the physician, and I know what's best for you. So you go and do what I think is best for you. That whole thing. Um, what do each of you, in our current situation, find that you're what are you doing in your own way to try to keep caring alive, if you will? Maybe personal level or professional level.
Christine, you want to go first here?
Or
Pardon
Justin. I think
me?
I'd like to attack this at the personal level because so far I've talked predominantly about my professional experience. In my personal life, I've gotten a bit lackadaisical about helping people I don't know well. So, for example, earlier this week, former recovering person got in touch with me for the first time in forever and said, "Are you available? I'd like to run something by you." And I was like, "Oh, I'm kind of busy this weekend. I don't know if I want to. This sounds inconvenient." And then I thought, that's crazy talk because as they say in certain recovery programs outside of treatment centers, it's about being of service to others predominantly. I like to think there's a factor in being of service to yourself, but I rethought my negativity and I realized taking this woman to a metro park to go for a short hike and talking about what was bothering her was really the right thing to do, even if it wasn't the most convenient.
Yeah, I think that's a great point, doing that. I think that'd be, just giving them that support they need themselves and having that person to talk to. And, going out in an open environment like that is a great place to just get out, active and, sitting there staring each other in the face as much. It's more open, for discussion. I think that was a great situation, a way of handling situation. I've actually been dealing with a weird situation lately. An old client of mine, my old workplace, for some reason gave her my phone number and she's been trying to reach me and I really don't know the best way to handle that. Isn't that crossing a boundary right there? And like, why would a business do that? Hand out your personal information. But there needs to be ground rules established a lot of times. But yours was more of a colleague though, you said, right?
She was closer to a colleague figure than
Okay.
I said client, but I was kind of using the word liberally, to be candid.
Okay.
For me personally, we have where we live, we have some really wonderful neighbors. And one neighbor is a police officer for Homeland Security. Now, I've noticed he's been a nice family and we get along okay. But I've noticed he's been out of town the last week or so. I'm sure we have our differences. And now I'm faced, given what's going on, I want to be friendly and I want to be genuine at the same time. I mean, saying hello when a car goes by, waving, and that sort of thing. but I get caught up in my own stuff about what's happening in our country. So I know I need to keep caring alive because they are neighbors and they've been okay. We exchange cookies at Christmas time, you know. I mean, just little things like that that are important. So that's where I'm struggling right now at a personal level. You know, the third area, and I know I'm jumping along, Christine, you have another engagement today, is given the threats that are coming at us, you know, to dismantle healthcare, be it medical healthcare or behavioral healthcare. What do you think? What direction do you think we need to start moving to reclaim care to keep care alive?
So personally, I think here it would be creating more environments where open discussions on different ideas, and this is one of the best starting points to get other people's ideas, bring each other together, and some people can bring forth things that have worked for them, what they found to be great solutions for these problems. Because I'm sure there's plenty of people that have realized this on their own and have found ways that they could handle it. And I think coming together and being able to collaborate with more people, it would be a great way to do that. And I think, what we're doing here is a great place to provide a structure for that.
Well, I know that was our original intention, what you just said, to welcome people because we don't have all the answers. Who does? But to be able to discuss, to talk, to explore, to think of new ways to help one another. Christine, what are your thoughts about where we can where we
I have a lot of thoughts, but I think the most appropriate thought, for not being too political or too outlandish, the most appropriate thought is double down at the grassroots level.
uh,
More potlucks, more community building, more churches open their doors for people of all faith and no faith to have gatherings together. More of
well,
that good old fashioned, we're in this together. If, God forbid, a horrible regional or national disaster happened and it affected us all, who would we have? We would have our community.
yeah.
And that community in that case would usually be the people that are physically in our proximity. You mentioned neighbors, Don, and I think that's a great example. These are the people we rely on when push comes to shove if something were to happen. And I think gathering more energy, positive energy, by bringing people together is absolutely essential.
Well, as you both have said it so well, I think to conclude this session, I've learned more at a more significant level listening to both of you, the power of empathy, and that empathy built into community building, that we're at the point where we need each other. We have got some great neighbors. I call them Old MacDonald has a farm neighbors. They're wonderful people, chickens, geese, ducks who come over and graze in our yard. You know, I mean, it's a silly thing, but we're so close. They're like family. They're really like family. And we know without saying it, we can count on each other. So I like all that. I assume that, not assume, but I imagine next time we'll open this discussion to everyone and anyone. Is that correct? Okay. Do each of you want to
Absolutely.
add anything in summary or conclusion today?
I do have one additional point I'd like to make. And again, I'll use that reference in the beginning, point being very much the appropriate word. Um, I was thinking about empathy and how you cultivate it in um, people that are essentially strangers to one another, have very, very little overlap in their daily lives or their regularized interests or their families or their churches or their synagogues, what have you. I think of this concept, and I'm just now thinking of it, to be perfectly candid with everyone. It just occurred to me of an empathy point, meaning each person in this newly found duo would find one single point of that they could relate to or that they have in common with the other. We don't agree on anything whatsoever, but I really love baseball. Really love it. And you really love baseball. And so we're going to bond about baseball and the history of baseball and how we played baseball as little kids. And everything else, we totally don't agree. It could also be, I'm
Yeah,
thinking of your
like
neighbors, like vegetable farming, vegetable gardens, something you might have in common.
That's a great
Even
idea
if you
because it
don't
gives a
agree
place
on
of starting a
absolutely anything.
conversation.
go
What's
ahead,
that?
Justin.
I say I definitely agree because it at least gives a people a spot where they can start the conversation at, and then talk more and see, they might actually get along, and they can go from there, and instead of sitting there and feeling like they're in complete disagreement just because they can't come anything off the top of anything.
Well, I've really enjoyed this conversation with you folks, and to the world out there, welcome. We're here, we're ready, and we can't wait to get engaged with you and with one another. Thanks to you too this evening.
Yeah, thank you.
Thanks, John. Bye, everyone.